Good evening, everyone, and welcome to the No Buts About It Breathing Easy at Home virtual town hall. My name is Marina Cintron, and I am the director for the Community Health Alliance. I will be serving as your moderator tonight for tonight's event. So I'm delighted to welcome our first speaker for tonight, Brian Lee. We have additional speakers, Lydia Greiner, Janette Rodriguez, and Liz Williams. But to begin, I'll be first introducing Brian Lee. And Mr. Lee is a health promotions manager and grant project director at the American Lung Association. He is dedicated to serving the community and advocating for better policies for public health and environmentalism. He currently serves as a project director for the 3 state and local government grants in the counties of Los Angeles, Orange, and San Diego. Brian Lee graduated from UCLA with his BA degree and received his master's at CSULV. Brian, and it's an honor to have you. Please welcome Brian.
Thanks, Marina. Hello, everyone. Again, my name is Brian. So I'll be talking about smoke-free multi-unit housing and specifically the dangers of secondhand smoke. Next slide, please. My presentation outline will cover 1, the American Lung Association's history and mission, 2, the State of Tobacco Control Report, and specifically our gradings on multi-unit housing, 3, secondhand smoking dangers, 4, just general information on smoke-free multi-unit housing, and 5, just providing some resources on that effort. Next slide, please. So the American Lung Association's mission is to save lives by improving lung health and preventing lung disease. Our organization's vision is a world free of lung disease, and we do that through multiple different strategic imperatives. And that includes defeating lung cancer, championing clean air for all, improving the quality of life for those with lung disease and their families, and creating a tobacco-free future. So today's presentation is mostly talking about that last strategic imperative for creating a tobacco-free future with the hope of, smoke-free multi-unit housing policies. Next slide, please. So the American Lung Association releases a report called the State of Tobacco Control Report on an annual basis. SOTC for short, evaluates states and the federal government on proven effective tobacco control laws and policies. The 2021 report focused on the importance of ending tobacco use amid the pandemic and on how smoking is a risk factor for the most severe COVID symptoms. Specific to California is a little bit special with this report, is that each jurisdiction and each local city within California has their local policies graded for tobacco control. So the next slide will cover the different methodologies that we go over for the report. But if you're interested in finding your local grade for your local city, you can see the report now and see whether or not there is a smoke-free multi-unit housing policy in place. Some interesting California facts that were on the last report. There were roughly $13 billion from economic costs due to smoking. This includes health insurance costs, days off at work, missing school days, things like that. The adult smoking rate is currently at 10% for California. The high school smoking rate is at 2%, while the high school tobacco use rate is at a 12.7%. And middle school smoking rates, this is around 12 to 14 years old, is around 0.7%. And then smoking attributable deaths per year account for 39,950 deaths each year. Next slide, please. So the grading methodology behind the State of Tobacco Control Report includes 4 different areas. So 1, there's the smoke-free outdoor dining areas. 2, the smoke-free housing area, which is what we'll be focusing on today. And 3, the reducing sales of tobacco products. And 4 includes emerging issues, what we call bonus points in terms of what they define in their policies, their municipal policies, including, flavored tobacco or things like that. But specifically for the smoke-free housing, what we look at for each city's policy before we grade is whether or not they have non-smoking units in apartments, in condos, and non-smoking common areas, both internal and external. Next slide, please. So the importance of smoke-free policies, and this is where we'll talk more about secondhand smoke and the dangers of it. The US Surgeon General stated that there is no safe level of exposure to secondhand smoke. So any amount that you're being exposed to is going to be, affecting your body some way, somehow. Each year, roughly 41,000 non-smoking adults and 400 infants die from secondhand smoke. Smoke-free policies definitely have important health benefits for both residents and on-site employees. And residents, of multi-unit housing buildings spend a lot of their time within them, especially during, the period of quarantine when not many people were leaving their homes. We saw an influx of calls from the community saying that they were being exposed from their neighbors from this secondhand smoke. Next slide, please. So some key facts about secondhand smoke. It causes approximately 7,330 deaths from lung cancer and 33,950 deaths from heart disease. Between the period of 1964 to 2014, there were roughly 2.5 million people that died from secondhand smoke exposure. Secondhand smoke can cause, but not limited to, stroke, increases risk of heart attacks, lung cancer, coronary heart disease, and reproductive effects in women. So clearly secondhand smoke has some effect on the body. And, people assume sometimes, I guess it's nowadays people are more aware of it, but before, they weren't aware of the full effects that cigarettes had. It's both on the person smoking and also the people around them as well. Next slide, please. I like to include this because a lot of people have pets. And secondhand smoke does affect pets in their homes. Tobacco smoke affects a dog depending on the length of their nose. Certain dog breeds are at increased risk of nose or lung cancer. Cats who live with people who smoke more than a pack a day are 3 times more likely to develop lymphoma, which is an immune system cancer. Smoking is even more dangerous to birds, guinea pigs, and even fish as well. So some people are aware of the effects that it has on their body and to those around them, but sometimes they're not even aware of the effects that it has on the pets that they have, or on the pets that they have. So it's really important to recognize that secondhand smoke just spreads not only from your unit, but to other units as well. So not only the families and the pets of one unit are being affected, but others could be potentially as well. Next slide, please. So how many chemicals does a cigarette have? Well, it has over 4,000 chemicals. 43 of those are known carcinogenic compounds, which means that they can potentially cause cancer. 400 other toxins include nicotine, tar, and carbon monoxide, as well as formaldehyde, ammonia, hydrogen cyanide, arsenic, and DDT. The next slide will basically cover a visualization of all of those. Next slide, please. So as you can see, this is just a few of the dangerous chemicals within a cigarette. And when you light the cigarette, that smoke produces secondhand smoke and affects others around them. And so the unwanted smoke is definitely causing some negative effects to people breathing it in, especially when you're in other units in multi-unit housing. Those smokes can travel through cracks in the windows, under doorways, through electrical wiring, and even through plumbing systems. As you can see through this visualization, there's a few just different household items that are found within cigarettes. For example, lighter fluid and butane. You have batteries and cadmium. Tar is what they use on the streets. So it's really dangerous chemical compounds that, one, you're breathing into, and two, you're causing others to breathe in as well. Next slide, please. So we also like to highlight what the effect is on babies and children. because their lungs aren't as developed as a fully grown adults. So secondhand smoke in babies and children can cause sudden infant death syndrome, severe asthma, respiratory problems, stunted growth, ear infections, and weak lungs. This secondhand smoke is really dangerous for those young children within the household. And we found that young children as well spend most of their time within their homes. So they're not leaving outside to go to work. They're, at home. If they're not in school, they're mostly at home. Next slide, please. So what exactly is smoke-free multi-unit housing? Well, multi-unit housing units are any that are owned or rented, and it can be any attached home, basically. So those include townhomes, condominiums, housing and cooperatives. You have apartments are the, rented apartments are the major and most well-known multi-unit housing buildings, but it's not limited to just those types. And there are a few conditions that smoke-free multi-unit housing policies can apply to for these different buildings. So one, you can apply it to inside the building and the entire property. So including 100% smoke-free units is what we strive to have for all buildings within a city. Two, you can include a percentage of the units, like I was saying, to be smoke-free. And the preferred percentage is definitely to have 100% smoke-free. If you have one unit that's smoking or a few units that are smoking, it's definitely still going to affect the people around them. And three, you may or may not prohibit smoking in common areas. So again, common areas are things like, the washroom, the swimming pools, and it includes any external and internal common areas. And what we want is obviously to have all common areas smoke-free. Next slide, please. So smoke-free multi-unit housing, some more facts on it. Nearly 80 million people in the US currently live in some form of multi-unit housing. 28 million of those people are exposed to secondhand smoke each year. Secondhand smoke, again, can migrate from other units through doorways, cracks in walls, electrical lines, plumbing, and ventilation systems. And children, elderly, and the disabled are most vulnerable to secondhand smoke, again, because their lungs aren't fully developed as an adult, or they're not as developed in the case of elderly. Next slide, please. So this is in a response to market demands. A national polling says that 90% agree that people should be protected from secondhand smoke. 91% of adults in the United States do not smoke already, and 83% of adults do not allow smoking inside their homes. So if we just look at the national pollings and the national response to this issue, it's a very popular issue to support. And we found in LA County as well, when we go into the different cities, people already don't allow smoking within their own homes. So it's an additional benefit to have smoke-free policies because it will respond to what people are already aligning with. Next slide, please. There are some legal misconceptions behind smoke-free multi-unit housing policies. People ask, what about smokers' rights? Well, neither smokers nor the act of smoking are protected under fair housing laws. So smokers aren't a protected class of people. So it's completely, as the next question is asking, it's completely legal for landlords and cities to adopt policies and rules to protect their properties. One, because, people are being affected by secondhand smoke, but two, because the properties are going down in values due to smoking, yellowing the walls or smoking causing the stain in smells and things like that. But yes, properties and owners can prohibit smoking inside rental units and outdoors on their properties, including all the suggested areas, doorways, balconies, common areas, things like that. But yeah, this should definitely be a policy that most homeowners and property managers consider. And it has definitely beneficial effects of limiting secondhand smoke exposure for the residents within their buildings. Next slide, please. So moving on to some resources, this is actually suggested steps from the American Lung Association to protect you and your family from secondhand smoke. One, you can check your lease and rules for policies in your building prohibiting smoke, because if it's already in your lease, that's more power to you to speak out on the secondhand smoke exposure that you're being exposed to. Two, you can check your local jurisdiction to see if your city is smoke-free, and that's why I brought up the State of Tobacco Control report that we released yearly, because you can just look at that report, go to your city, and see whether or not your city has a policy in place. Three, you can talk with your neighbors, but we want to encourage engaging and working together safely with your neighbors that are smoking. We don't want any hostile environments being created, and it's just to ensure that everything is kind of going forward peacefully. So yes, definitely, if the opportunity presents itself, talk with your neighbors. Four, you can also talk with your doctor about secondhand smoke and your health, and getting notes from your doctor that say, secondhand smoke really exasperates certain conditions that you have will definitely be helpful in the conversations that you have with either your neighbors or your property managers as well. And that leads to the fifth step, is talking with your landlord or property manager. And six is kind of the last and most extreme steps. It's not the most ideal steps that you can take, but you definitely can move to different areas that are smoke-free. I know a lot of modern buildings nowadays are going completely smoke-free. And you can, we have seen legal options be brought up and brought into court. So those are some of the last steps that you can take, but again, they're not the most ideal. Adopting a building-wide smoke-free policy is definitely the best way to protect all the residents from secondhand smoke exposure, and it's what we recommend as well. Next slide, please. So smoking cessation resources, the American Lung Association is committed to promoting quit smoking information and resources to on-site staff and residents. So, if you know anyone interested in quitting, we have definitely a lot of programs focused for cessation services. One of our flagship programs is the Freedom from Smoking program, which you can join as an individual for free, and it will help you, take the steps necessary to, hopefully be on your way to quitting smoking. Next slide. I believe that's all I have. There is my contact information. So if you want more information on the dangers of secondhand smoke, feel free to contact me. If you want more information on the resources that we have on how to protect yourself from secondhand smoke or our cessation programs, feel free to contact me as well. But yeah, thank you for your time, and I'll pass it on to Marina.
Thank you, Brian, so much. It was very informative, especially the steps that people can do for themselves. Thank you very much. Our next speaker is Dr. Lydia Greiner. Dr. Greiner is a nurse practitioner and an adjunct professor of psychology in the College of Sciences at San Diego State University. For the past 3 years, she has been the coordinator at the Third Hand Smoke Resource Center. Dr. Greiner is responsible for sharing information about third-hand smoke to the general public, stakeholder groups, such as healthcare providers and property managers. So let's welcome Dr. Greiner.
Thank you, Marina. Today, I'm going to be talking about third-hand smoke, what it is, and why we should care. Could I have the next slide, please? I'm delighted to be here speaking as the coordinator for the Third Hand Smoke Resource Center, which is located at San Diego State University. We're funded by California's Tobacco-Related Disease Research Program, which is supported by taxes on tobacco products. Next, please. Our mission is to share information, resources, and technical support with California's residents, communities, businesses, healthcare professionals, and policymakers about the toxic legacy of tobacco smoke residue, and to achieve indoor environments that are 100% free of tobacco smoke toxicants. Next slide, please. I'd like to quickly acknowledge our leadership team. We're headed by Dr. Jörg Matt, professor of psychology with more than 20 years of research experience into the issue of third-hand smoke. He is our director. Heather Whipfley from USC and Rachel Record from San Diego State are our co-directors. And then there's me, I'm the coordinator. Next slide, please. So what exactly is third-hand smoke? I'd like to start with a definition so that we're all on the same page. Brian's done a great job of orienting us completely to first-hand and second-hand smoke. So thanks, Brian, for that. Third-hand smoke is the toxic chemical residue that remains in indoor environments, on surfaces, in dust, and in the air after smoking stops. But how are second and third-hand smoke connected? Next slide, please. What we call third-hand smoke starts out as secondhand. Secondhand smoke is about 15% what is exhaled by the smoker, and about 85% what is comes from the smoldering tip of the cigarette. And this distinction is really important because the side stream smoke from the smoldering cigarette is significantly more toxic because it burns at a lower temperature, so it is incompletely combusted, and therefore it has a higher proportion of toxic compounds in it. When we see secondhand smoke, it looks like a grayish cloud. The cloud is actually a collection of tiny droplets of literally thousands of different chemical compounds, and even smaller, ultrafine, invisible droplets and volatile, fast-moving gases. And it's those fast-moving gases that we smell. Secondhand smoke gases and small particles travel quickly, as Brian's mentioned, considerable distances throughout a room, a home, down hallways, into neighboring apartments, through utility ducts, ventilation systems, so that units on different floors and down the hall are very easily affected. Secondhand smoke remains in the air while smoking takes place and for up to 3 hours afterwards, depending on the ventilation. But what happens when it vanishes? Next slide, please. The transformation from secondhand smoke into third-hand smoke begins basically immediately once a cigarette is lit. The gases that are emitted in secondhand smoke stick on surfaces and they're soaked up by materials in the indoor environment. The particles deposit and accumulate in settled house dust. And ultimately, the gases and particles become embedded in materials. And then additional chemical reactions create new chemical compounds and form new particles. Next slide, please. So this one's a little tricky. I'd like to introduce you to apartment 605. Andrea's going to help me walk through this slide. You can see there's a baby and the baby's toys and typical furniture and carpeting and curtains, as you might find in any apartment. So click 2 times, please, Andrea, and you can see that someone is smoking and secondhand smoke is coming into this environment. One more click, please. And you can see that immediately these chemicals, the particles and the gases are being deposited and absorbed as third-hand smoke. 5 more clicks, please. It basically goes everywhere. Toys, rugs, walls. The more secondhand smoke there is, the bigger the reservoirs of third-hand smoke are created. Ultimately, the walls, furniture, and objects become stained, and you can smell that stale tobacco smoke. If you could click 5 more times, please, Andrea. What's happened? The source of the smoke is gone. The smokers moved out, for example. There's no new secondhand smoke. However, the third-hand smoke remains. And 5 more clicks, please. And under certain conditions, the particles and gases that are in the furniture, in the walls, are re-emitted and resuspended in the air. The particles then settle in house dust, and chemical reactions cause new chemicals to be formed. So thanks, Andrea, for running through that with me. Next slide, please. So why does third-hand smoke matter? Third-hand smoke is a mixture of chemicals. We know many of them have bad health effects. When we're looking at the health effects of third-hand smoke, it's important to distinguish between the effects of short exposure and chronic long-term exposure. Short-term exposure, I mean, you stay in a hotel room where there's been a smoker, for example, or you visit the home of a friend who smokes. Short-term is minutes or hours of exposure, and people report a range of respiratory symptoms, allergic skin reactions, headaches, earaches, eye and throat irritation, like you might experience with secondhand smoke exposure. With chronic long-term exposure, I mean living in a home that's polluted with third-hand smoke or daily close contact with someone who smokes. So days, months, or years of exposure. We know that when that occurs, we can see DNA damage in cells, changes in our immune system and our immune response, interference with organ development in children, changes in the reproductive system, liver function, and wound healing. So multiple systems can be affected by exposure to these chemicals. Next, please. How are people exposed? Because it's in the air, dust, and on surfaces, there are several ways these chemicals can get into our bodies. People can swallow third-hand smoke when they put fingers or objects that have been polluted into their mouths. They can breathe it in when the particles and chemicals are in the air, and they can absorb it through their skin when they come into contact with surfaces that are polluted with third-hand smoke. Babies and young children are especially vulnerable. Next slide, please. They're more vulnerable for several reasons. As Brian mentioned, babies and young children spend a lot of time at home and a lot of time indoors, more than adults. Their body surface is large relative to their weight, so they have a large surface for absorption. Their respiratory rate is faster than adults. They breathe more times per minute, so they have more opportunities to breathe it in. And they also, as we all know, put everything they can find, their hands, their toys, and everything else into their mouths. So they have plenty of opportunities for ingesting third-hand smoke chemicals. Next slide, please. Oh, I'm sorry, I have to click that again. Thank you. So one would expect to find third-hand smoke in homes of an active smoker. That wouldn't really be very surprising, but that's not the only place it's found. It's also found in homes of non-smokers if they move into an apartment where a smoker previously lived. If they live in multi-unit housing where other residents currently or previously smoke in neighboring units or in shared spaces, or if they purchase a condo or a home owned by a smoker. And one of the really interesting things to keep in mind is that this third-hand smoke persists in indoor environments for years. So the smoker could have lived there 4 years ago. Someone else moved in, a non-smoker, and you move in and you could still be exposed to the third-hand smoke from the 2 tenants previously. In a recent study of 210 apartments in San Diego, smokers and non-smokers were interviewed. 100% of the apartments had evidence of nicotine. The non-smokers were people with strict indoor smoking bans. So in their own homes, they did not allow smoking, yet they still had evidence of nicotine. That shows how persistent this can be. Residents of multi-unit housing are more at risk, and the older the building, the greater the likelihood. In California, much of our multi-unit housing was built in the mid-70s when smoking rates were about 30%. So any factors that are associated with higher rates of smoking mean that the housing is more likely to contain third-hand smoke. Even in units with smoke-free policies, enforcement can vary, and residents may be hesitant to voice complaints. In housing markets where there is little affordable housing, like in California, residents often feel as if they have very few options. And this cartoon is just an illustration of the importance of keeping smoke out and the potential for policies like smoke-free housing policies to do just that. Next slide, please. I'd like to discuss as we finish up some promising prevention strategies that we're developing, and then end with a few comments about dealing with third-hand smoke pollution. And prevention in this discussion is about preventing exposure to existing third-hand smoke, not prevention of third-hand smoke, which we could do if we stopped smoking. Okay, next slide, please. One thing that we are working on with individuals or groups who are concerned about the presence of third-hand smoke in their homes, workplaces, or vehicles is a do-it-yourself testing project. And the goal here is to empower individuals and groups by providing data about the presence of third-hand smoke in indoor or enclosed environments. We develop individualized sampling plans based on the problem, send out a sampling kit with instructions, conduct analysis, and then prepare results and recommendations. And this is all done at no cost to the participant. And this is an example of results that we would send out. The blue arrow reflects what we typically see in homes with strict non-smoking bans or strict smoking bans. The pink arrow reflects what we see in homes where smoking occurs, but only outdoors. And the red arrow is where people smoke inside. The green triangles represent the results from samples that were taken indoors in this particular condo. And you can see the first sample is well below what we would see in homes where there is no smoking, and this is a non-smoking home. However, the other two samples, S2 and S3, are consistent with what we see in homes where smoking takes place indoors and outdoors, actually. And those, just for the record, just as a point of interest, came from the inside of the HVAC system. Next slide, please. Another promising prevention strategy is our collaboration with real estate professionals to try to encourage the open discussion of the history of tobacco use in homes for sale or lease with prospective buyers, sellers, and renters. As a first step, we are developing an educational packet for them to voluntarily include in real estate transactions. And we're also working with them to look at avenues for policy change. In California, there is no requirement to disclose to a buyer or ask the seller about smoking. And also, However, there is one question on the Board of Realtors seller questionnaire, which asks about tobacco use on this property. However, there is no follow-up to that question, and it is not required that it be answered. Next slide, please. Last but not least, a big question: how do we get rid of it if we have it? So, as we discussed, third-hand smoke accumulates in reservoirs, drywall, carpeting, furniture, flooring, ceiling tiles. The size of the reservoir depends on the intensity and the duration of smoking. Removal of third-hand smoke from surfaces has been shown to be effective in the short term with cleaning strategies that we have developed. However, if there's been a lot of smoking for a long number of years, it may be necessary to remediate and possibly even remove drywall, remove carpeting, remove flooring to get rid of the reservoirs. And my last slide is a call to action, which is to encourage you all to educate yourselves, your colleagues, and your families about third-hand smoke. It's real and it hurts people. Share information with policymakers, environmental advocates, city planners, and educators. Find out what policies exist now in your city to protect you, your family, and your community from toxic tobacco smoke. And you can learn more at our website, www.thirdhandsmoke.org. Sign up, you'll get a newsletter with monthly updates. You can follow us on social media. And if you have a need or a question, reach out to us, contact@thirdhandsmoke.org, and we will get back to you. Thank you so much.
Thank you so much, Dr. Greiner. Very insightful, very informative. I'm sure a lot of people had no idea what third-hand smoke was, so thank you very much. Our next speaker is Janette Rodriguez, and Janette is a regional coordinator with the Latino Coordinating Center for a Tobacco-Free California, also known as LCC, funded by the California Tobacco Control Program, and a project manager on 2 research studies that examine secondhand smoke exposure in multi-unit housing. She has more than 15 years of experience in tobacco control and research. So thank you, Janette, for joining us tonight.
Thank you, Marina. Hi, everyone. It's really nice to be here with you all today. Thank you, Brian and Dr. Greiner, for that great presentation on secondhand smoke and third-hand smoke. I do want to give you a little warning. I've been having issues with my display. At moments, it goes all black, but I still can hear you, and I think you'll still be able to hear me. So if I pause a little bit, it might be because of that, but I'll let you know I'm having technical difficulties. As Marina mentioned, I'm part of a couple of research projects at USC, and that's what I'm here to talk about. I'm going to be focusing on a research study titled Triangulum, Tobacco, E-Cigarettes, Marijuana, Secondhand Smoke Exposure in Low Socioeconomic Multi-Unit Housing. This research study was funded by the Tobacco-Related Disease Research Program. I'm going to be focusing on some of the data from this project in particular. Next slide, please. Really quick, I wanted to show you a picture of our diverse team of investigators, staff, and students that have helped us with this project, as well as the community advisory committee members in the next slide. Without our team, we would, we wouldn't have been able to do this project. So I just wanted to acknowledge every single person on this team. So what is the triangulum and what do we mean by it in our study? And Andrea, you could do the next slide. Well, the triangulum is the intersection of tobacco, marijuana, and e-cigarettes. And before I move on, I did want to share that the first person that I heard coin this term triangulum was Dr. Phil Gardner, and he is a colleague of mine, tobacco researcher. He actually is now retired from the tobacco-related disease research programs, but he's also the co-chair of the African American Tobacco Control Leadership Council. And I wanted to give him proper recognition for that term because that's the first time we had heard it, and immediately we knew that we needed to study these intersections because of the passage of Proposition 64, which is the use of recreational marijuana, as well as the increased popularity of e-cigarettes. So that is why our study focuses on the triangulum. I also wanted to share, I know that Lydia and Brian have already talked about secondhand and third-hand smoke, but I'm not going to go into detail about that. Next slide. I actually just wanted to share with you what the definitions were that we shared with the people taking our survey. Just to be clear, when we talked about secondhand smoke, we made sure that people understood that we were not only speaking of tobacco smoke, but that we were also talking about cannabis or marijuana smoke, as well as aerosols or vapors from electronic smoking devices or vaporizers. In regards to third-hand smoke, we first asked them if they knew what third-hand smoke was. And then after they gave us the response, we provided a definition to them. And this is a definition that we provided. And essentially, it's a smoke or aerosol that settles and lingers in rooms, on walls, carpets, curtains, and furniture long after smoking stops and remains on our clothes after we leave a smoking place. And Dr. Greiner did a really great job of describing what third-hand smoke is. So I'm not going to go into detail with that. Next slide, please. Also, the past presenters have already done a great job of describing the problems with secondhand and third-hand smoke, but I thought it was really important to include this slide because really this is the impetus for our research, right? This is why we do this research. We know that many vulnerable populations are unwillingly being affected by secondhand and third-hand smoke. Next slide. So we know that a known strategy to help reduce or eliminate secondhand smoke and maybe reduce third-hand smoke is establishing smoke-free policies, and in particular in multi-unit housing. Liz from the Americans for Non-Smokers' Rights will be talking about this later, so I'm not going to go into detail. But what I did want to share is that currently the city of LA does not have a formal citywide policy prohibiting smoking in multi-unit housing, which is a main reason why we did this study. Next slide. So the purpose of this study was to collect information that can be shared with the community, such as everybody here in this webinar, and also to help inform policymakers and stakeholders about what tenants feel about secondhand smoke exposure and about their support for smoke-free multi-unit housing policies. As you all know, I feel really strongly about research because I feel that data can really push policies, and in particular multi-unit housing policies, which in turn will help decrease secondhand and third-hand smoke. And also these types of studies help to raise awareness and give vulnerable populations a voice on these issues. So we collected door-to-door interview surveys with tenants living in Los Angeles, but in predominantly African-American communities, predominantly Hispanic Latino communities, and predominantly non-Hispanic white communities. And we did that because we wanted to be able to compare between communities and also between ethnicities. We conducted this, again, we did door-to-door interview surveys, but we also conducted focus groups. I did want to point out that from here on out, sometimes I will be sharing data from the community perspective, but you will also see data on the slides from as it relates to ethnicities of the people that responded to our survey. So sometimes I will be sharing different information in that way. Next slide. So here is the present, the percent ethnicity breakdown by each community. So as I mentioned, we collected data in predominantly African-American communities, Hispanic, Latino, and non-Hispanic white. So you could see that in each of those communities, we all know that LA is very diverse. So even though in predominant Latino communities, you will have, African-Americans, non-Hispanic whites that live in those communities, right? So overall, though, from our total sample, we have 37% of our survey respondents identified as Hispanic Latino, followed by African American at 31%, and followed by non-Hispanic white at 20%. Next slide, please. A little more than half of the respondents were women at 62.5%, and half of the participants have completed at least high school and high school education, and 18% of survey respondents have less than high school education. Next slide. The majority of participants at 79.8% currently do not smoke. And I think this is really well known. Most people do not smoke, right? 10.3% of our participants currently smoke every day, and 9.2% smoke some days. In our sample, African Americans have the highest rates of current smoking, both by community and ethnicity, while Hispanic Latinos have the lowest rates, both by community and ethnicity, so the Hispanic Latino. Next slide, please. Sorry. We also asked about their cannabis use or marijuana use. 25.4% of all our survey participants smoked cannabis in the last 30 days. And in our sample, African Americans have the highest rate of smoking marijuana, and while the Hispanic Latinos have the lowest rates of cannabis use. Next slide. Of those that stated they used cannabis in the past 30 days, we asked if a doctor or other healthcare professional had recommended the use of cannabis. And only 37% reported that it was a recommendation by a healthcare professional. Tenants living in African American communities reported a higher percentage of recommendations by healthcare professionals compared to other communities. Next slide. When it comes to using e-cigarettes or vapes, the majority, 67.7% of participants do not currently use e-cigarettes or vaping devices at all. Non-Hispanic white communities members have the highest proportion who currently do use e-cigarettes or vaping products, while the Hispanic Latino community has the lowest percentage. Next slide. Among all ethnicities, a quarter of them know someone who has smoked marijuana in their home. So like 25% of our total sample have said that they know somebody who has smoked marijuana in their home. Hispanic Latinos have the lowest percentage of that at 9%, while African Americans and non-Hispanic whites have a higher percentage of people smoking in their homes. Next slide. We asked survey participants how much they think people risk harming themselves physically if they smoke one or more packs of cigarettes per day, but we also asked about using marijuana in different frequencies, which is the green columns, and then also using e-cigarettes with nicotine and or marijuana, and which are the turquoise or blue slides. Here you could see that we've done a really good job in educating people about the risk of smoking cigarettes. As you could see, 81% or almost 82% stated that there's a great risk in harming themselves physically if they smoke one or more packs of cigarettes per day. However, when you ask about marijuana, that risk perception goes lower, and then it slightly increases with e-cigarettes, and then it increases when you ask in terms of combinations of marijuana use as well as with e-cigarettes. Next slide. We also asked about participants, you know, what their attitudes are about smelling smoke from tobacco, cannabis, or e-cigarettes. And these are people that said that it bothered them. So 77%, I'm sorry, I'm having a hard time reading this. Oh yeah, 77% of participants stated that smoke from tobacco bothers them. But as you could see, that number decreases when you ask about marijuana and e-cigarettes. Next slide, please. Okay. When we asked about how annoying they find people smoke or vapor, 53.3% stated that they find tobacco either extremely annoying or very annoying. However, fewer participants or individuals find cannabis and e-cigarette or vape pen aerosols as annoying as tobacco smoke. So only 37.3 find marijuana annoying, and 24.7 find e-cigarette or vape pens extremely annoying or very annoying. 1/3 of respondents find marijuana and e-cigarettes not annoying at all. And the next slide shows exposure to secondhand smoke. So more than half of survey respondents stated that they have had secondhand smoke drift into their home in the last year. And 46% have had secondhand smoke drift from the outside, and 35% stated from another unit. I also wanted to point out some of the differences among communities, with the non-Hispanic white communities having lower exposure to secondhand smoke. And I'm running out of time, so I'm going to go a little quicker. Of those that stated secondhand smoke drifted into their home in the last year, most of the secondhand smoke was from tobacco, but as you can see, a large percent is coming from cannabis as well. And there are differences between communities, between these products and exposures of these products as well. Next slide. We also wanted to assess the survey's participants' knowledge of third-hand smoke. And as you can see, only 21% of participants stated that they had heard of third-hand smoke. And approximately 4% stated that they had smelled odor or smoke in the home when they moved in, and 13% stated that they smell smoke on their furniture or walls or carpets currently. Next slide. And I'm being told I need to close, and I just have a few more slides. I apologize for going over. I didn't realize. So let's see. Let me see if I could go through. My apologies. Give me a second here. I do think this is important. So 43.4% of all respondents either agreed or strongly disagreed with the statement that they would prefer neighbors to use marijuana in an edible form instead of smoking or vaping, breathing in a smoke or vapor from these products. Next slide. We also asked if they would, how they would feel if an apartment had a smoke-free policy, if they would be okay if people used these cannabis for medical reasons. And as you could see, 64.6% stated yes. Next slide. Now I'm going to skip that slide. Go to the next, to the second to, there we go. You can stop right before, sorry. Yes, this slide shows you the number of people that actually support a partial or 100% smoke-free policy. And as you could see, close to 70% of respondents were in favor or of a partial smoke-free policy. And the next slide, when we asked, actually, when we divided this information by the actual smokers, you could also see that 72% of the current marijuana smokers and 75%
percent of the current tobacco smokers or marijuana smokers, and 81% of the current tobacco smokers actually want to have or are in favor of smoke-free policy. So there's a large majority support for these types of policies. So in conclusion, I just wanted to share that as you saw from the data, people are highly being exposed to all of these, next slide, to all of these, exposure from tobacco, cannabis, and e-cigarettes. But one thing that I wanted to point out is that people are compassionate about individuals who are using cannabis for medical reasons. And we need to educate the community on the various forms of using cannabis products. Next slide. And I also think that it's important that we educate people on the issues of secondhand smoke from cannabis as well as from e-cigarettes. As you could see from the data, there's a very large difference in perception of these products, but as we all know, all of these products cause secondhand smoke and third-hand smoke issues. So next slide. The next slide is just my contact information. So if you have any questions, I went through that information really fast, and I apologize that I went over time. Thank you.
Thank you, Janette. It was a very insightful presentation and it was amazing information. So don't worry about going over. We will still have time for enough questions from the participants at the end. Our next presenter and our last speaker for the night before we enter into the questions is Liz Williams. And Liz Williams is a project and policy manager at the Americans for Non-Smoking Rights and the ANR Foundation. She provides technical assistance support, training, and resources to public health professionals, advocates, and the public on issues related to secondhand smoke and smoke-free policy change efforts, including multi-unit housing, college campuses, outdoor spaces, e-cigarettes, secondhand cannabis smoke, and preemption. Liz has worked for ANR and the ANR Foundation since 2002. So I'm happy to invite Liz.
Hi, everyone. Thank you so much. So as Marina said, I'm Liz Williams with the American Non-Smokers' Rights Foundation. We are based up in Berkeley, and we work to protect everyone's right to breathe smoke-free air. So I am really glad to be invited to join you all tonight at this town hall. And what I'm going to do is talk about smoke-free multi-unit housing policy trends. So next slide, please. Thank you. So to build on what Brian, Lydia, and Janette spoke about, I'll focus on policy trends that we're seeing here in California. The major trend is that cities and counties are expanding their local smoke-free air laws to include multi-unit housing. The first laws to prohibit smoking in apartments and condos were adopted 13 years ago, back in 2008 and 2009. And for many more years, we've seen property owners adopt their own smoke-free policies for the buildings that they own or that they manage. And there are a number of reasons why both types of policies continue to grow. I think the most significant one is that residents are sharing their stories about having to breathe a neighbor's secondhand smoke, like what we heard Janette's research cover. And that they're asking their landlords and their city council members for protection so that they can have a healthier living environment. And the goal of smoke-free laws and policies is to change the social norm about not smoking in ways that harm other people. I know that requiring apartments to be non-smoking can seem like a really big and hard change, but we have to remember it used to be normal to smoke in offices and to smoke in restaurants and bars, and it was even normal back in the 70s to smoke in grocery stores and on airplanes until the 1990s. So can you imagine if someone lit up a cigarette in a grocery store right now? People would be shocked and they'd say, hey, sorry, man, you've got to take that outside. That's not okay here. And what happened is people have started speaking up over the years and demanding to simply breathe clean air in different environments, and then the laws started to change. And so now we're taking that next step so that families can breathe smoke-free air at home. Next slide, please. So let's look at the two main ways that buildings are becoming smoke-free. The first policy option, and the one that's really the gold standard, is for a city or county to adopt a local law that requires people to not smoke in multi-unit residences. The city councils and boards of supervisors, they have the authority to adopt smoke-free laws for multi-unit housing. And that's in the same way that they can adopt local smoke-free laws for workplaces or for parks or for other spaces. And in terms of numbers, there are now 67 communities with local laws that require rental apartments to be 100% smoke-free. And the vast majority of these laws, 61 of them, cover all types of multi-unit housing, and that's both the rental and the owner-occupied properties like condos. And most of these laws also apply to buildings with 2 or more units. And then there's another 20 communities that have partial laws that cover some buildings or some residents, but they have big gaps in protections. So thankfully, it is very encouraging that nowadays, nearly all of the newer laws are strong, and don't leave any residents behind. The next slide, please. Thank you. On this map, you can see where the communities are that have the stronger laws. Most of them are in the LA area or up in the Bay Area, although these laws have been adopted in 14 different counties. And I think it's exciting to see the progress and to see these little blue houses appear way up on the Oregon border in Crescent City and as well in the Central Valley. And there are 62 laws that are currently in effect, and there's another 6 laws, the ones in green, that aren't in effect yet. We hope to see Los Angeles on this map someday. Next slide, please. The other main policy approach is for the owner or management of multi-unit buildings to adopt a smoke-free policy for their own properties. And these policies are adopted for market rate buildings by landlords, by property management companies, condominium boards, and homeowners associations. And they're also adopted by for affordable properties as well. This includes buildings that accept Section 8 choice housing vouchers and nonprofit housing and public housing agencies. So California adopted a law back in 2012 that specifically said landlords have the right to make their properties smoke-free, and this was very helpful and removed any doubt that some landlords had that it was possible to do so. A downside to this approach, though, is that it is a slow process to go smoke-free building by building, and there's also a risk that a new landlord could overturn the policy in the future. So local laws have the advantage of providing more stability, and they also cover more people. However, these voluntarily adopted policies are still important because they show that smoke-free buildings can work, and they show that there's demand for smoke-free housing. And it's just like how restaurants and bars back in the 90s, they chose to go smoke-free by their own choice, even before it was required by law, and then that helped set the stage for local laws down the road. Next slide, please. The landlords who are interested in adopting a smoke-free policy are in really good company, and we first suggest that they get in touch with local tobacco control programs and community partners because they can give a lot of great advice and information. You don't have to reinvent the wheel. Also, Los Angeles has a rent stabilization law, so it's important to read up on the guidelines that govern how to change policies in a rent control or rent stabilization community. We also suggest that buildings form a planning team to discuss and plan for all the logistics that are involved. And we also suggest surveying residents about secondhand smoke exposure and their thoughts on potentially having a smoke-free building. And we really encourage not rushing the process. We say, take the time to involve the residents, educate residents, involve local partners, and really think things through because it is better to do it right than to do it fast. Next slide, please. Now, what does a strong smoke-free housing law or policy look like? So first, the standard is now for laws and policies to require that all units of all buildings be 100% smoke-free. That's everywhere indoors as well as on and in some outdoor spaces. Communities really shouldn't settle for less than all units of all buildings being smoke-free because we know that eliminating smoking and vaping indoors is the only way to prevent exposure and protect health. And also private use outdoor spaces like balconies and patios are really important to include because these are areas that are a big source of drifting smoke. Local laws should apply to both rental and owner-occupied buildings. And that's because secondhand smoke drifts through all types of buildings. And it doesn't really care if you rent or you own your unit, the health risks are the same. Likewise, all types of secondhand smoke are a health risk. So e-cigarettes and smoking and vaping cannabis should be included as well. And we also know from experience that the best laws and policies don't have exemptions and they are simple, strong, and fair in their wording. That means they can be more effectively protect health, but they also are easier to understand and follow. Next slide, please. So I want to highlight something I just mentioned. It's very important to include e-cigarette use in cannabis or marijuana in smoke-free housing protections. And that is because smoke is smoke, and smoke-free spaces should be free from all types of smoke. And really, a building is not completely smoke-free if only tobacco smoking is prohibited. If e-cigarette use and cannabis smoking and vaping is still allowed indoors, it's really not a smoke-free environment. And it's also a real challenge to enforce a policy that treats e-cigarettes and cannabis differently from tobacco. And just because cannabis is now legal, it does not mean that it should be used in ways that harm other people. And like Janette shared, residents are reporting that they're exposed to vaping and cannabis smoke at home. We also need to be prepared because cannabis lobbyists, especially the last year or two, they are becoming a lot more organized and vocal. And they are trying to exempt cannabis from smoke-free housing laws. So we need to educate city council members about the importance of breathing air that is free from all types of things. Next slide, please. I also want to mention enforcement, since that's a big topic of interest. Enforcement of local laws can vary from community to community, but the process often includes requiring residents to sign a smoke-free lease addendum or the equivalent rules for a condo. And then violations are enforced by the landlord or by the condo board. But it can also be really helpful to have a city enforcement mechanism, and that's necessary in a rent stabilization city like Los Angeles, since there can be limitations on requiring changes to lease language. The city mechanism could look like including a complaint process that goes through a city agency, but then there could be graduated penalties where a resident would receive educational information and warning letters for their first few violations, and then there could be fines for additional violations. And it should also be a complaint-driven process, just like other types of smoke-free laws. No one is going out into the community to try to find someone who's smoking in their apartment. It's only a neighbor is bothered by the smoke, and then they would call in that. Also, many communities are putting more emphasis on social justice generally, with the desire to create more equitable policies, the ones that support residents and reduce financial penalties and reduce contact with law enforcement. The goal for smoke-free housing laws is to reduce secondhand smoke exposure, and to do so by fostering good compliance and to support rather than punish residents. And we also aim to do this without resorting to eviction, because we don't want to put anyone's housing stability at risk. But eviction for smoke-free violations is very, very rare. And we think it still should be on the table as a last enforcement option after the other more supportive options. But we encourage communities to discuss with stakeholders what a successful law could look like, and then what equitable enforcement could look like. Slide, please. Now I want to share a local example. So up in Alameda County, which is where I live, the coalition is currently working on an ordinance for smoke-free multi-unit housing. And the goal is to have a law that is adopted and enforced in an equitable way. So they especially want to protect and involve lower income residents who have more exposure and more health disparities. And also they've been hit hard, first by the housing crisis and now by the pandemic. So the coalition started by forming a work group of diverse stakeholders. The participants included all sorts of different people, including tobacco control partners and affordable housing agency, the county's health equity office, and resident advocacy groups, as well as residents themselves. The work group is led by a community-based organization that serves the Latino community and low-income residents. And they've done a really great job running the campaign, including hosting strategy meetings that really worked to develop equitable policy language and to think through how enforcement might work. The work group has been meeting over the last few years, and during 2020, the proposed policy language was brought to community members to get their input, and it was done using surveys and online focus groups that were held both in English and Spanish. The most recent step was bringing proposed language to 4 community advisory councils for their input, which helped influence the language. And next up is finally bringing the proposal to the Board of Supervisors, and we think that will happen in December. So it has been a slow process, but I think it highlights how It's really important to involve many people and many perspectives to help make sure that an eventual law reflects the community's needs and desires. Next slide, please. So lastly, we have a variety of resources on our website that support smoke-free housing, all sorts of different educational tools. This includes a model smoke-free housing lease addendum, all different types of fact sheets, and a list of communities that have 100% smoke-free housing laws. So you can find all of this information on our website at no-smoke.org/at-risk-places/home. And feel free to check all of that information out. Next slide, please. And then finally, this is my contact information. Feel free to reach out if we can be of use to you. And thank you so much for having me.
We did have a great discussion, but the discussion doesn't have to end here. You can also learn more about the Community Health Alliance by visiting our page at smokefreelungsla.org and by following our social media platforms. You can find us on Instagram at smokefreelungs_LA and on Facebook at Community Health Alliance.
Thank you all and have a great night.